What the doctor office conditions are like is a question that I have been asked quite a few times. And it's hard to answer that question because it really depends on the doctor that a person chooses to go with. Some doctors have clinics that are cleaner than others. Some doctors have clinics that are in more or less disrepair, so that varies widely. Of course, I can only speak on my own experience with Dr. Boppet. In my opinion, his clinic conditions were fine by me. Was it of the standard of walking into a Canadian hospital? No, it wasn't. So if anybody chooses to follow my footsteps and they want to go see Dr. Boppet, I would highly recommend him, but don't go in there expecting that his clinic is going to look like a hospital back home, because it won't. The clinic was very, very clean, and it was very, very minimal. So basically, it seemed to me that he had what he needed and nothing more, nothing less. And that didn't bother me at all, because even if in Canada the doctors and the nurses and the staff had the most up-to-date state-of-the-art equipment and the best of the best of the best as far as the material things are concerned, my doctors still were not able to fix me. And my major concern was having one treatment, getting my life back, and not having a recurrence. So, in my opinion, the issue for me was not what did the clinic look like, as long as it was clean, and my doctor's office was very clean, and his practices are also very clean. He always made sure to wear rubber gloves when he was working on me, wash his hands after each procedure, so I was never worried about him using equipment on me that wasn't sterile, or that his hands were not clean enough, or anything along those lines. So my major concern was that I be with a doctor who was trained and had the practical experience to do what they needed to do, which was to heal me and to not have my fistula come back. Before I came here, I heard that the standards of cleanliness were different over here in India than they are in Canada, and that is true. But with that being said, different doesn't always mean bad. So I think that's something that you should think about yourself. If you want to come and you want to have kshar sutra, certainly check out the doctors, interview them with as many questions you possibly can think of, and ask to see pictures or video of their clinic, because there's really no point in coming over and having a doctor work on you when you're not comfortable with their clinic conditions. I think that you need to be comfortable with that as well, be comfortable with their practices. So ask all of those questions. Don't feel too afraid to ask anything and everything, or don't feel rude, because at the end of the day, this is your health and your journey, and you need to be as comfortable with the doctor, the clinic, the cleanliness as you possibly can. My biggest concern when I came over here, because I already knew that the conditions wouldn't be what they are in Canada, it wasn't that, it was that what was going on right here and here. So the skill of the doctor, the knowledge of the doctor, and their skill with their hands, that, in my opinion, is what is needed to fix somebody's fistula. And I hope this isn't too controversial or antagonistic, but if you are concerned about the cleanliness of a clinic, ask your questions. But if that is something that you feel would hold you back, then maybe you should ask yourself if the standards of cleanliness were so important. And I'm not saying the difference between being dirty and being clean, because my doctor's clinic was clean. It just wasn't that his equipment was the best of the best of the best that we might have in Canada. And that, of course, doesn't apply to every clinic in Canada or every hospital in Canada either. But I would ask myself the question, perhaps you want to ask yourself the question, what's more important, the doctor's skill and knowledge, or whether or not they have state-of-the-art equipment? Because if the deciding factor of whether or not you're going to get healed from this awful disease and get your life back was having the best equipment, the most up-to-date, top-notch, state-of-the-art gadgets, then why is it that so many doctors in Canada are not able to easily fix high complicated fistulas?